Ecstasy by Olmo and Tori VanCleave. What is ecstasy? Ecstasy is a synthetic psychoactive drug with amphetamine-like and hallucinogenic properties. Comes and is taken in a tablet form, which is often branded. Ecstasy is classified as a Schedule I drug, which means it's highly dangerous, has a high potential for abuse, and has no accepted medical use. As you can see, ecstasy can cause serious physical damage and alter appearances to its users. Behavioral effects of ecstasy. Ecstasy lowers inhibition and relaxes users. Ecstasy increases awareness, feelings of pleasure, and energy levels. Side effects include headaches, chills, jaw clenching, eye twitching, blurred vision, and nausea. In low doses, ecstasy does not cause hallucinations, despite popular belief. In the picture in the bottom right corner, you can see a diagram of hospital visits due to ecstasy use. In 1994, it was far less common to see hospital visits due to ecstasy use. By 2000, it has drastically gone up, seeing over 4,000 recorded cases. Psychological effects of ecstasy. Ecstasy appears to have several effects on the brain. Ecstasy can cause the release of the neurotransmitter called serotonin, block the reuptake of serotonin by the synaptic terminal that releases it, as well as deplete the amount of serotonin in the brain. Psychological effects continued. Many of the psychological effects of ecstasy are due to its actions within the limbic system. The ability of ecstasy to produce mild stimulation is due to its actions in another part of the limbic system, the basal ganglia. It is here where ecstasy's effects on the dopamine system may be important. The heightened perceptions involved the actions of ecstasy in the neocortex. Ecstasy can also reduce the appetite because it acts in the hypothalamus, which controls feeding behavior. So, should ecstasy be used for therapeutic purposes, such as for treatment of depression from loss of a loved one? MDMA was first used in the 1970s, not as a recreational drug, but as an aid in psychotherapy, although without the support of clinical trial research or FDA approval. In 1985, the DEA labeled ecstasy a Schedule I substance. Some researchers remain interested in its potential therapeutic value when administered under carefully monitored conditions. It is currently in clinical trials as a possible pharmacotherapy aid to treat post-traumatic stress disorder and anxiety in terminal cancer patients. Ecstasy should not be used for therapeutic purposes despite these clinical trials specifically for patients with PTSD. Ecstasy can be extremely dangerous with a high potential for abuse and damage to the brain, making the possible advantages for medical treatment invalid. Here is our works cited. Thank you.